Hi, Kathy's back with Dr. Workman. We just finished injecting Dr. Workman's right cheek with 0.6 mLs of Voluma, and that really brought him back into balance. Before we started, we noticed that he was a little more sunken on this right side, and he looks a lot more balanced. He still has a little volume deficit, which is awesome because we have the other part of the syringe, so we're going to use, you know, a little bit more on the right side because he was more hollow there. But as I kind of was finishing, he's still a little sunken in the tear trough area, so we've decided to do just a little bit of a product called Belotero, and it's a wonderful, it's the polar opposite of Voluma. Voluma has, as I showed you, the very high G prime. It has a really dense, it defies gravity. Belotero has almost a 0 G prime. It was actually designed to go very superficially into very fine lines. It's a beautiful product for horizontal or vertical lip lines, periorbital rhytids. It can go into all of these little lines here because you inject it right into the superficial dermis. Because it's designed for that, the tissue under our eyelids is the thinnest skin on our body. And so a lot of the other products, especially Voluma, would be horrible for that. Juvederm, Restylane, other hyaluronics have been used in the tear trough area, but often we get this kind of bluish, almost bruised discoloration that's kind of opalescent looking that they call a Tyndall effect. And for whatever reason, even though Belotero is a clear gel, it doesn't tend to Tyndall. And because it's a really soft product, it lends itself really well to this area. So I was pretty excited when it came out a few years back. The technique for tear troughs is kind of an interesting one. A lot of the injections that I do with something called a blunt cannula needle, and it's not sharp, okay, which sounds kind of counterintuitive, but a needle has a bevel on it, and it kind of slices its way through the tissues. It slices through skin, it slices through little baby capillaries, which may leak, which cause bruising. It can slice through little tiny nerve endings, which can cause pain and discomfort. So what we find is the use of the cannula needle is a blunt tip. So we inject a little local anesthetic into the area. We make a little pilot hole with a larger needle, but it's totally numb. He won't feel that a bit. And then we use this blunt tip cannula and thread into the tear trough area. And the beauty of that, it's a much safer technique. And I know the plastic surgeon, the facial plastic that I've worked for, said years ago when he filled tear troughs with the old needle method, it was almost as if they had had an upper and lower blepharoplasty. They were bruised for up to 2 weeks. It almost looked like a surgical issue. 9 times out of 10 with the blunt cannula, we have little to no bruising. And we also kind of minimize that by mixing a little bit of lidocaine with epinephrine into the product because that vasoconstricts the area.
Yeah, I mean, I think the other interesting point, you know, from a historical perspective is the tear trough used to be an area that was just off limits.
It's kind of a no-fly zone.
Yeah, it was kind of a no-fly zone. I think with the the Belotero and some of the more viscous or some of the fillers that actually will flow better. I mean, suddenly we've been able to open up that whole area of facial rejuvenation.
And I would say if you are going to treat your tear troughs, ask your provider how much experience they have with that, because it's not something that just everybody does. And when they're overfilled or improperly filled, they can look worse. The beauty of all of the hyaluronic acid fillers is that all of them can be dissolved with an enzyme. And I had bad filler in my tear troughs for almost 5 years before I got into this industry and had no idea I could get rid of it. And was very pleased to know that I could get that out of there. And I now use Belotero in my tear troughs. All right, so this little anesthetic is similar to what you would get maybe at the dentist or if you were getting stitches in the emergency room. It's a little bit of lidocaine, a little bit of epinephrine, a little stick and a sting. I do buffer it a little bit with some bicarb, so hopefully it won't hurt quite as bad. And the interesting thing about using this, I don't know if you can see it on camera, but sometimes we'll get a little bit of blanching, and that's from the epinephrine in the product. But the beauty of that is that because it constricts all those little vessels, it minimizes bruising and bleeding. So it's a really nice way to go. So we have our little wheel there, or a little bleb, and you can see it's kind of whitish in color. And then we take a needle, and I can see he's got a vessel right here, so I want to stay away from that so I don't give him a shiner. And how is that comfort-wise? Hardly even feel it, huh? There you go.
To say that.
Anesthetic is wonderful. Oh no, you're good. We've got you anesthetized where we want to go.
No, you're good.
Now, the interesting thing, it is an odd sensation when we thread this cannula in toward the intercanthal area of the eye. So
show more of the intercanthal.
That's the inside corner of the eye. So what we do is we thread this cannula along that trough, and we get into that very far corner. And you can see our cannula just slides beautifully into the area. And then I can kind of manipulate it and see where my tip is. And we just do a very thin little thread along there. And go ahead, open your eyes and look up toward the ceiling. Sometimes I can see a little bit more of that deficit when you're looking up. And go ahead and close your eyes. And it's amazing, you can do a lot in the tear trough with very little. Mo better. I like it.
When she's happy, I'm happy.
Yeah, well, I'm kind of picky. I like things to look perfect. I always tell people when I put a needle in your face, it's like signing a work of art, and I don't want my name on bad art. So let's look. That's the icing on the cake. We're going to give you just a little titch right here. And the beauty of the cannula, with certain products, you can go all over the face through one injection port, or, you know, very few, so you're not getting multiple punctures like you can with some products and some injectors who aren't comfortable using the cannula. This thing has pretty much revolutionized my practice as far as patient comfort, what I can do, and downtime, because it really makes a big difference. I, a year or so ago, had a client, and we were trying to get a certain area. He says, you know, I just kind of want to do that one little spot with the needle. Instant shiner. So, lesson learned. Not even one little spot. In the tear trough, at least. All right. Your wife's not even, she's going to think she's having an affair with the younger man when you come home tonight. I think that looks good.
Good.
It makes me happy. So, again, we've completed pretty much the right side of his face. We've completed his Botox all the way around, and we're going to come off camera, and I'll finish this left-hand side, and he'll be all ready for his upcoming vacation.
Excellent.
And looking amazing.
All right. Thank you very much.
Thank you for joining us.